Now, the Kenya School of Government in Nairobi has been closed as a quarantine facility after all those who were quarantined there tested negative after the 2 required tests. There are quite some good news and good stories coming from the place, but there are public health workers who were disinfecting the facility today for the second time.
Public health officials preparing to fumigate the Kenya School of Government premises and rooms, marking the end of the quarantine stay for 140 people. Perhaps the longest overlay ever for those who had to undergo mandatory quarantine here soon after landing at the Jomo Kenyatta International Airport. Dr. Philip Tendet, who was in charge here, giving a reflective report.
Most of the times the guests were allowed to walk around the big space around, walk into the field. There's a big football field there, they could walk around, take walks.
4 people from this facility were confirmed positive and subsequently taken to different hospitals. 2 have fully recovered. The officials here were also tested for COVID-19 and the results were negative.
Before we hand it back to the Kenya School of Government and allow for the good use of the public again, we want to make sure that it is well disinfected. We will not have any more risks to any other persons who will come here.
The rooms of the 4 were marked. All their belongings were still in the room. The fumigators made sure every corner of the room was safe. Vehicle-mounted fogging machine was also used to disinfect the place. Cases of misconduct were also reported at the facility, which led to the Minister of Health extending the quarantine period. 4 people were arrested for misconduct and failure to comply with the guidelines.
Some of the guests managed to sneak in with their alcohol and were really misbehaving after using it. The police came in, helped us, and we restored the discipline.
More closures of quarantine centers will hopefully be the case across the country in the weeks to come, but not just yet, and only if everybody does their part to help contain the disease. Halima Gongo, NTV.